This is the Louisiana Hometown Network, bringing you public information, coverage of the monthly meeting of the Louisiana Board of Regents for Higher Education and the Board of Elementary and Secondary Education, also known as BESSE.
Should parents immunize young children, and why?
Absolutely. Why? Because they can protect them against serious diseases that exist in our communities and are only a plane ride away. It's that simple.
Parents should definitely immunize their children. It's safe, proven protection against 14 different diseases before a child even turns 2 years old, and it's always a great idea to keep your child protected against these diseases.
Young children should be immunized, and their immunization should be up to date. Young children are at risk of significant disease. Measles is a good example. If you don't take your measles vaccine or don't give your child measles vaccine, they're at risk. They're at risk for a lifetime of significant disease. And so children should have their vaccines, and they should be up to date. There are two things wrong with not vaccinating your children. First of all, your child is at risk. They're at risk for acquiring those significant illnesses. They're also at risk to the community, because if they get sick, then they expose other people. And so there are two important reasons for children to be vaccinated: protect themselves and help protect the community.
Flu spreads very easily simply because people cough and sneeze around other people. That's how it spreads. And it's spread particularly efficiently by young children and school-age children. All you have to do is to be around a toddler with a runny nose, and they are just a little kind of a spray valve of influenza virus.
Vaccines are very, very safe. The FDA and CDC are very involved in testing the safety of vaccines and in monitoring that safety of vaccines, and I feel they're safe enough that I have 3 children and they're all fully immunized, so I have confidence in the safety of vaccines.
No vaccine is 100% safe or 100% effective. But when you look at the relative benefit of being immunized versus the risk, it's all in favor of the benefit. Most reactions to vaccines are short and what we call self-limited, a sore arm or a fever that lasts less than a day. Serious reactions to vaccines are extraordinarily rare.
We've made a lot of progress in immunizing children against significant childhood diseases. Measles has almost disappeared. We're seeing a resurgence now because people aren't being vaccinated. We've eliminated childhood meningitis. That's an amazing thing. We used to see childhood meningitis every week in the hospital, and now it's virtually disappeared. And that's a significant disease, which not only can it be fatal, but in children who survive, they very often have deafness. And so we've virtually eliminated that as a cause of deafness in our society.
Vast numbers of children in the U.S. are vaccinated. Almost all children in the U.S. are vaccinated according to the recommended schedule. There are small groups that refuse one or delay one or more vaccines. But we have the highest immunization levels in the U.S. we've ever had today.
Overall, nationally, rates are very high, and we are meeting all of our healthy people goals, and we're doing a very good job of keeping the children in the U.S. protected, and less than 1% of children across the U.S. have no vaccines at all.
What age do you start giving vaccines to children?
Well, it can even begin before the children are born. Women can get a dose of Tdap vaccine while they are pregnant to help protect their babies against whooping cough during the first 2 months of life, when a baby is very vulnerable to complications of pertussis, but they have no protection because their shots don't start for that disease till 2 months. But there's also a birth dose of hepatitis B, so shots start right away to start protecting those little ones.
Well, the vaccine that I'm most concerned about is the one that we use least, have the greatest potential to improve, and that's HPV, or human papillomavirus vaccine. It's a vaccine that prevents cancer. And I really think that if you have a son or daughter who's in the 9 to 15-year-old age group, and you don't vaccinate them against HPV, you want to think about what you're going to say 20 or 30 years from now if they develop a cancer. or have to deal with medical procedures because of HPV infection. I'm not trying to lay a guilt trip on everyone, but we can prevent cancer. Hepatitis B vaccine is another vaccine that protects against cancer. And when we have that ability, it seems to me sinful not to use it. It's a virus that causes warts. It's a virus that causes cervical cancer. Can men get it? Absolutely. And men do get it, and they get genital warts from some HPV viruses, and they get cancers of their genital tract and oral tract, just as women sometimes do. Unfortunately, there are often no symptoms for cervical infection. If warts are warts, and you will know that, the symptoms of mouth infections or genital infections elsewhere are equivalent to having a wart in those locations.
What should the public in the United States know about Ebola?
First, they need to understand that this is an infection of a virus that does not exist in the U.S. Second, I think as we look at the ravages of Ebola, we understand the impact an infectious disease can have on the population. I wish we had a vaccine against Ebola. I hope someday soon we will. The chance of getting Ebola in the U.S. now is non-existent, infinitesimal. But I think it's a lesson about what infectious diseases can do and about why vaccines are so helpful when they are available. And I'm pretty confident that we will have a vaccine against Ebola, but it may not be for a year or two.
Ebola, of course, is a terrible disease, but there is no Ebola in the United States. We may see a few imported cases. We know how to treat it. We know how to prevent its spread. It's not ever going to be a problem in the United States. It's a problem in West Africa. It's a big problem in West Africa. And the best way to help is to send our healthcare professionals there to take care of Ebola and then welcome them back when they come back. We don't need special quarantine laws. What we need is to help our neighbors. After all, if your neighbor's house is on fire, the best way to prevent your house from catching on fire is to put the fire out at your neighbor's house.
This January, it will be the 200th anniversary for the Battle of New Orleans. There are going to be many exciting events going on in St. Bernard Parish and also in Orleans Parish. This is the big year. A lot of people have been waiting for this, the 200th anniversary. We're going to have all kinds of live battle reenactments going on, living history tours, cannon firings. There'll be a symposium, a lecture series going on at NS Community College. There will also be some functions going on at the Cabildo to recognize some artwork that represents the War of 1812.
Tell us from a historical perspective just how significant this battle was.
Well, this battle, even though what people do not realize is this battle helped us to secure, us being the United States of America. Even though the treaty was already signed, if we wouldn't have fought the British would have gained control of the mouth of the Mississippi River, and therefore we might not be New Orleans, Louisiana today. We could belong to, the United Kingdom.
Where are these events going to be taking place?
The events will be taking place at the National Park, the Chalmette Battlefield, and also the Woodlands, which is behind the St. Bernard Parish Government Complex. That's where the live battle reenactments will be taking place.
And what will people see when they come out there?
For the live battle reenactments, they will see a sutler's village, there will be vendors, there will be reenactors dressed in the time period for the War of 1812. They will see how the people during that time period were preparing themselves for the Battle of New Orleans. And at the National Park, there will be living history tours. You'll be able to go up in the obelisk and have a view of the city of New Orleans. There will also be, the Welcome Center will be open where people can go in and also view the artifacts that they have in the visitor center.
Who should attend these events?
People of all ages and children, especially to show the children this is how people were preparing for the War of 1812. They can see the cannon firings, see the park rangers speak, see the reenactors do dual artillery battles. So there's a lot going on for the children and for families of, people of all ages to see.
When do all these events begin?
The events will begin on January 8th. January 8th will be the wreath laying ceremony that will happen at the Chalmette Battlefield. Then we will head over to Jackson Square for 11:30 for another dedication for the War of 1812, the Battle of New Orleans. January 9th, on Friday, there will be school field trips at the National Park. Visitors are also welcome to come to the National Park. They can also go back by the Woodlands, by the Living History Foundation, and to see the reenactors have their live battle reenactments and tour the Sutler's Village. On Saturday, there will also be 3 live battle reenactments. There will also be events going on at the National Park Service as well, with cannon firings, living history tours, cooking demonstrations. People will be cooking, how they were kind of preparing, the women to feed the soldiers before they went to war. There will also be the closing ceremony on Saturday, January 10th. The closing ceremony will be at the National Park Service. And on Sunday, there will be the actual Battle of New Orleans reenactment. When people come to St. Bernard Parish, besides coming to the Chalmette Battlefield, we also have the Los Isleños Village, which is about the Canary Islanders, the first settlers that came to St. Bernard Parish. We also have the St. Bernard State Park. We also have many local restaurants and shops if people would like to come and get a taste of St. Bernard.
If people have questions like more information, what should they do?
Please, you can visit our website at visitstbernard.com. You can also visit our website at chalmette2015.com, or please call our office at 504-278-4242.
Today we've got General Clark out speaking to some veterans here at Cafe Du Monde, and we're just talking about veterans issues, especially as it relates to the Lifeline phone program. There are currently about 36,000 veterans here in Louisiana that depend on the Lifeline phone program, from everything from looking for a job to keeping up with their doctor's appointments, to being able to call 911 in the event of a medical emergency. So he's down here to help us sort of bring shine a light on the issue for us.
I'm down in Louisiana talking about Lifeline phones. These are the phones that are provided as a public service to the people in society who need them the most. The elderly, the infirm, the veterans, the unemployed, the people who have to be connected to be able to get medical treatment, report an emergency, deal with a hurricane, or get a job.
And how is it possible that Lifeline's able to get these phones?
Well, there's a federal program, but it's not part of the United States budget. It's actually a contributory program paid for by the phone companies, and then they enable the veterans or the people who qualify as very low-income people. Those people are eligible to get a basic phone for like 150 minutes a month. No web browsing, no data. This is just to make telephone calls on. But it is a program that was set up by Ronald Reagan in 1984, extended by President George W. Bush in 2005, and it's a big deal for the people. There are 36,000 veterans in Louisiana who use these phones, and they need them. They need them to get medical help, they need them for jobs. And there's another 150,000 elderly people who have them. So it's a really great public service. It's what we do in America. It's part of our Christian duty. We take care of people, and I'm real proud to be down here talking up this program.
Today we're talking about Lifeline, a phone service that provides service to homeless veterans and veterans in general. Which I think is very much needed because, if you can call and you can reach out to people, you can gain access to a whole lot of things. Yes. What we're doing is working with the VA and HUD-VASH to do housing, transitional housing for veterans, where we intake veterans, assess them, assess their needs, help them gain access to birth certificate, Social Security card, anything that they need to get assistance. Once we assess them and intake them, we help them with transportation, help them make doctor's appointments. We are hiring full-time staff where we feed them breakfast, lunch, and dinner. And, I have social workers work on their well-being, their state of mind, and help them transition to be independent veterans.
Okay, and what would you like people to know?
Well, I'd like them to know that this Lifeline program is good for the communities because it connects people, but it doesn't cost the federal government a penny. It's all paid for by the phone companies and by a 40 cents per month contribution from the individual telephone subscriber that goes into this unified service fund. And that's what pays for the phones, and that's what brings our communities together. So if we didn't have it, we'd have to invent it.
The Lifeline program is awesome. I believe it's going to help connect family members. It's going to help them do all types of things that would allow them to achieve things in life. Lifeline is one of those programs that, when you look at the scope of it, it just helps you keep going. It just helps you give you that hope that you connect. If you're looking for a job, if you need anything, it can help you with those type of services. Who doesn't need a phone? Who doesn't need to reach out and touch someone in this day and age, right?
Okay, and how can people contribute? How can they help to solve this issue?
Just by bringing awareness to the issues, and pretty much, letting the congressmen know, letting the senators know that this program is very much needed in Louisiana, and we do not want to do away with it at all.
And what can people do to help?
They can check us out on our website. It's just www.louisianaforlifeline.com, and they can sign up to volunteer or also contribute. It's a very tough issue, and we need all the help we can get.
You can go to any phone company and ask about Lifeline phones, and you have to meet one of 7 eligibility criteria. You have to be on food stamps, unemployed, receiving housing assistance or utility payment assistance. If you meet these as your certified low income, one member of a household is eligible for one of these phones, and then when you move out from that category, you get employed or you've made enough money, you don't need the assistance anymore, you've got to give the phone back. We need to keep America connected. Ronald Reagan knew it, George W. Bush knew it, and I hope the people of Louisiana will appreciate it and that they know it too.
Hi, I'm Parish President Natalie Rowbottom in St. John the Baptist Parish, and we'd like to welcome you to our Shop Local, Shop St. John campaign. This is our second year with this campaign, and its focus is to help support our small and local businesses here in St. John, and we encourage you to come and enjoy the Christmas experience here in St. John the Baptist Parish. Small businesses and local businesses are the backbone of our community. They support and hire our residents. They also support and hire people throughout the community that have family members who are often asking for donations and contributions and sponsorships to our quality of life and sports and recreation programs here. So we definitely want you to stay here in St. John, support the businesses that support you, and understand why it's important to keep your tax dollars here in St. John.
And what are those tax dollars used for?
Well, they're used for just about everything. The basic services that you receive, water, sewer, roads, all the activities that we sponsor through our recreational programs. Economic development is critical to the future of St. John, and it starts with our small businesses here in the parish.
The benefits of shopping local is that we have items to offer here in St. John that you can't find anywhere else. They're unique to St. John the Baptist Parish. When you shop locally here in St. John, our tax dollars stay here locally to help our schools.
Welcome to Yvonne's Boutique. My name is Simone Williams, owner of Yvonne's Boutique. As for Yvonne's Boutique, we offer clothing for plus size, medium size, small size. We don't discriminate. We cater to everyone. It's a one-stop shop. Clothing, accessories, handbags, also decorations. We have our party department where we can plan your party and you can dress at the same time. So it's a one-stop shop. A local store, you can come in, you can try it on. You don't have to worry about shipping back. You have more discount. It's so much more to offer. You can get to see, you can feel the material, feel the quality of the clothing, other than shopping online. So I say always a plus on shopping in person.
What about service after the sale for customers?
They're welcome to come in and switch something out if they're not, pleased or it doesn't fit the way they want. They're welcome to come and exchange it for something else in the store. Yeah. And of course, they cannot do that on the internet. It's important to shop local because you get to come in, you feel the garment, you get to see it in person, you get to try it on. Other than shopping online, you have to wait for it to come in, you have to see if it fits properly, and sometimes you don't get the option of shipping it back. That's the thing about shopping in person. Police, fire, schools, it gives back to your community that you're living in, I would say. I support everything in my community. Basically, I just had my turkey drive where I gave away 11 turkeys plus a basket full of canned goods and dry goods for 11 families that in need. I always, once a month, we will go down and feed the homeless down in New Orleans. I always give back. God bless me, and I'm blessing another family.
This is Fisher's Ace Hardware. We've been established since 1991. We have about 8 employees currently working for our store.
What does shop local mean to you and your employees?
Shop locally just means just what you just said. Shop here where you get hometown folks giving you legendary service. Know that when you do shop locally, your tax dollars accumulate here in St. John Parish.
Tell us a little bit about the importance of those tax dollars in terms of paying for police protection, fire protection, sewer, schools.
Pays for everything. The more taxes we collect here in St. John Parish, the better off the entire community is. We benefit from every phase of spending locally. Fire, police, schools. Just currently, we're going to have a new fire station right across the street from us. You always know that when you shop at Fisher's Ace, you get that personal touch. You get people that are knowledgeable. They've spent years in the industry. They know what you need. They get you in the store, back to your project, and then you can enjoy your life. I think it's the customer service, the friendly customer service here at ACE, and it's all local people, and local people stick together. I want to encourage you to shop locally because you will benefit also.
The name of our company is Advanced Marketing and Promotions. We're known in this local area as AMP. What we do at AMP, we're able to provide companies and individuals with products such as pens, pencils, cups, koozies, all that real fun stuff they like to give away to their clients. But we're also a full-service print shop. We have 2 locations. Our main location right here in St. John Parish. Our second location is in Slidell off of Gauze Boulevard. We have 6 employees, and we've been in the River Parishes for about 7 years now.
What does shop local mean to you and your business and your employees?
Well, shop local to me is something that we actually do here, and we practice as a business. Most of our products are bought right here locally. I was born and raised right here in St. John Parish. I've been here all my life, and most of my employees are also right here at St. John Parish. The advantages of shopping local is we keep our money right here in St. John Parish. We also provide jobs for my employees here. Most of us are born and raised right here in St. John Parish. I've been here all my life, and by doing that, we're providing, again, jobs for our employees here.
What are the advantages of buying local as opposed to buying off the internet?
Well, the advantages of buying local is you get the service, you get the customer service. A lot of times what happens is you go and buy online, and they have all these hidden fees and different things that they don't tell you about. For us, we're right here, and we provide you with exact costs on everything that you buy from us, and we're also beating their prices, so that's the advantages.
And what about customer service after the sale?
Customer service for us is like highly important. When you call us, you're always getting someone on the phone. You never get an answer machine from 7:30 to 4:30 every day, Monday through Friday. And we always follow up on everything that you guys buy. So whatever you buy, we're always making sure that you get it on time. Generating taxes is very important because a lot of things that we have in this parish is obviously coming from taxes. So we want to keep our money right here in St. John Parish because that tax dollar, instead of sending it outside of St. John Parish, let's keep it right here local.
This is Chung's Heavenly Suite, and we offered coffee and lunch. Mostly it's healthy sandwiches, and our business hour is 7:30 to 6:30. And Saturday we open 9:30 to 3 o'clock, and Sunday we close. And I've been here 5 years, and we just right off the I-10 exit. My shop is 2 of us work here, and I've been here 5 years. And I have the lunch and sweets, and especially my birthday cake is fresh whipped cream and mandarin orange and chocolate shaving. It's a really unique cake, and I wish you can come try. I think that everybody should use shop local because all tax money goes to parish, and we can more develop the Laplace, and people come, and we can have more nice restaurants and other things or events. And so people, when they pass up Laplace, and they can stop by for that something special programs, events. I encourage people to shop local. We need the Laplace is a nice location to the New Orleans and Baton Rouge. So shop local, we can more develop the Laplace better place.
This is PetSmart in Laplace. We are a Louisiana-owned company. We have about 10 to 12 employees here, and they're all from the Laplace area. We offer grooming. We have dog and cat food, toys. We also have apparel for them. We carry fish, small animal accessories. We have about, like I said, 10 to 12 employees. I love shopping locally. I hate to have to even travel out to go anywhere to get stuff. It's important because a lot of our employees, their families shop here. They let other people from Laplace know about PetSmart, and everybody's happy to have us here. I'm happy to be here in Laplace. We actually work with the St. John Parish Shelter right on River Road. They come out on Saturdays and do adoptions with this store in Laplace. We work with the veterinarian hospital right next to us for St. John Parish also. The donations that we have Chase and Lucky teddy bears. When you purchase it, 10% goes toward homeless animals, and we donate the stuffed toys to Easter Seals for children. We're trying to look for a place to donate them locally, but right now they're doing it with Easter Seals. The internet is not personal. We are here to greet you and help you with everything and that you would need for your pet. We have stuff on the internet, but when we order through the internet, you get it directly to the store. So all sales go to the store and helps to keep employees employed. You can also even order something and have it ready for you when you pick up at the store. So it's not like getting it sent to your house through the internet. And all sales, like I said, go to the store and helps to keep employees in our stores.
And what about customer service after the sale if people purchase items here?
Oh, we are very customer friendly. If there's anything wrong, if the animal doesn't like the food or anything, just bring it back and exchange it out, because sometimes the animals don't like the change in the different types of food. There's no problem with that. We are very customer friendly. We are always here to help the customer.
Greg's Neighborhood Market is, we call ourselves a friendly neighborhood market. We try to treat our customers right and give them good service and, good prices, the best we can do. Been in business 10 years. We have roughly about 25 employees, and we do a lot for the local churches and schools, and we donate a lot of stuff for the parish around here.
Why is it important that the public support local businesses?
Well, again, it helps with taxes and the community, just to keep a stronger parish, better roads, just everything. We try to, as long as we're doing good business, we keep as many employees as we can, And we have local employees in the parish.
What is the connection between people supporting local business and employees?
Well, the local people are supporting the local people basically by them working here. Well, the tax dollars stay in the parish. I mean, it helps with jobs and of course, like I said, the tax dollars.
In terms of all the 1,500 small businesses here, we're talking about family, friends who've been here and will continue to be here, and they'll spend their dollars that they earn here in St. John Parish. So we definitely want to continue to support our small businesses.
Well, the more people shop locally, the more the local businesses can hire local individuals to do all kinds of jobs.
The difference between spending it on the internet and spending it here locally is the local dollars spent here actually stay here to assist us with improving our quality of life as a whole, whether it be Little League, whether it be our churches, continuing to keep our local folks involved by employment opportunities.
The benefits of shopping local is that we have items to offer here in St. John that you can't find anywhere else. They're unique to St. John the Baptist Parish. When you shop locally here in St. John, our tax dollars stay here locally to help our schools.
When you do business with a local company, you have somebody that can service you locally. You can get them on the phone, you can drop by and see them, you can take whatever you bought and return it if necessary. You have service on a local basis.
Shop Local, Shop St. John campaign is important because it gives local businesses an opportunity to thrive and better serve their customers in our communities.
Businesses have a great impact. Small businesses are the engine behind economic development in St. John. They employ local people. It's a win-win situation for our community and for our parish.
The members of the St. John Parish Business Association and other businesses in the community are big supporters of local organizations. The schools, the churches, all the different fundraising organizations, the Little Leagues and those sorts of things all benefit from local businesses making those donations. And shopping locally is a key factor in producing the profits to allow that to happen.
What is the attractiveness of St. John Parish that brings people from all over the state to come here at Christmas time?
Well, I'd like to think we have a lot of unique products that you can purchase. You have that small town feel. You have the individual attention that a lot of our boutiques and small stores will give you. They'll help you and show you around the store and help you make good selections, and they'll even make things specific to your requests. We have a great variety of things to choose from here in the parish. We have great floral arrangements. We have small gifts. We have clothing boutiques where they'll help you pick things for a wedding, a prom, or just, to get the exact fitting that you need for special occasions.
On behalf of the St. John Parish Business Association, we want to encourage people to buy local and shop local.
By buying on the internet, those dollars do not come back to support our local Little Leagues, our local schools, or our local churches. So therefore, we encourage all businesses to get involved and be a part of the Shop Local campaign, as well as not just residents in St. John Parish, but our surrounding parishes. We need people to come out and support and buy to grow the community as a whole, as one region.
What is the link between shopping local and employment of people?
Shopping local and employment of people, we're very family-oriented here. So we like to not only grow them here, but we want to keep them here. So it gives you more of a family-oriented feel when you walk into one of the three parishes of St. James, St. John, and St. Charles. And that's important. People want to do business with people that they know. They want to do business with people they grow up with. They want to do business with people that they're comfortable with.
There's no customer service when you're purchasing on the internet. However, the other thing that affects you is there's no tax dollars. When you purchase on the internet, although it seems that you're getting a bargain, in the end you may be actually hurting your local economy.
How dependent is local government on sales tax revenue?
Sales tax revenue is a huge part of the parish's budget, and we watch it monthly to see what those trends are. We cautiously approach things with regard to infrastructure improvements over the long haul, and it is important as much as possible to keep your dollars here. Now, we know that St. John doesn't have everything that you want, but we have a lot of things, and we encourage you to visit our website and see the small businesses that are available. We encourage our small businesses to sign up on our economic development website so that we can help promote what we do have here locally. But we have a great variety of gifts. We have lots of food. We have specialty items, and we encourage you to just come out and visit St. John and take advantage of it if you're not from here. But we also encourage our residents who may not know of some of the places that are here to at least browse around and see what's here in St. John and shop locally, shop St. John.
What about visitors? How easy is it to get to St. John Parish?
Well, of course, we think we're very easy from New Orleans and Baton Rouge. We're directly in the middle along Interstate 10, or you can take Airline Highway. There are two exits, exit 209 and 206, that'll bring you to the heart of the parish. And we would just encourage you to take that drive, between the two, visit Airline Highway and see all that we have to offer here.
If people have questions like more information, what should they do?
They could go to the St. John the Baptist Parish website at sjbparish.com. There's an economic development website, and then our entire website is very user-friendly, lots of information there. You can find out what's happening here. You can get a list of the stores. You can get a map of the area, and you'll get a feel for what's happening here in St. John, and we definitely want to entice you to come.
Last year there was a 6-month open enrollment period. This year they're condensing that to a 3-month open enrollment period. So this is a very intense period of time that we're asking Louisianians to call, click, or come in and let us simplify the shopping experience. If your income has not changed from last year to this year, then basically you can renew without effort. But most people will want to go out and update their income to see if their eligibility for premium subsidies have changed.
Well, before I came to Blue Cross, I was in practice for 15 years as a primary care physician. So I think the most important reason to have health insurance is in this state and in most states, it's access to health care. I think it's not always easy to maneuver the health care system when you have no payment model. I think physicians and hospitals are set up to manage patients who have insurance in a much more streamlined and coordinated way. So it's about access first. And Blue Cross has a very broad access of really top physicians across the state. And so Blue Cross access is really a tremendous value to people. The second thing is just the cost of health care. If you have to bear the cost of an emergency or an unforeseen illness, it can be devastating to a family, and I think health insurance offers real protection against a devastating financial calamity.
Well, we certainly have products available in every zip code and in every parish of the state. We've worked hard with our distribution and all employees across the state of Louisiana to prepare for this open enrollment period. We simply ask you to call, click, or come in, or visit our website at www.bcbsla.com, and there we will help you navigate the system and simplify matters for you.
There's a huge opportunity to drive quality improvement in the state of Louisiana, specifically around cardiac disease, hypertension, diabetes, obesity-related illnesses. And we think primary care is the key delivery model to drive this improvement in the state. And so we really designed QBPC with the notion in mind that we wanted to make it easy for physicians to embrace change, to support them with lots of services and align payments for their ability to drive quality in the state, and it seems to be working so far.
The QBPC program has about 1 out of 4 people with high blood pressure in the program. So with that, when you control high blood pressure, it really prevents a lot of those very expensive and very life-threatening conditions, such as heart attacks and strokes. So just imagine after you have a patient with a stroke, well, now they're in the hospital. Now they have to be cared for and go through a rehab stay. And so all of those things not only impacts the patient and all of their families, and really puts a burden on that family and society. It does cost money to have that type of care given in those settings. And think about, for me, the way I think about this is the Blue Cross member is really the person at work. They really are the backbone and the economic engine that drives our state. So when you remove that person from their workforce, you have impacted society much greater than even that one disease. So now they're not at work. Now the company that they work for is impacted as well. So the ripple effect throughout our society is tremendous. It all comes back down to control your blood pressure, look at diabetes. It's really the basic stuff. This is basic blocking and tackling that we just need to do better. So the top practice site for diabetes is the Family Docs, and we appreciate you coming up and receiving the award. So if you don't mind staying still, because you know lightning does actually strike twice sometimes. For hypertension, also Shreveport Family Docs. For chronic kidney disease, East Jefferson Internal Medicine Group number 2. Okay, and yet again, for vascular, the Family Docs, yet again. Yay. And this is your last award, I'm sorry to tell you that.
No, it's not.
So these are the 4, really they're the 4 major medical conditions that they're in the program. The final award is, again, overall, who when you put all of it together, which site had come out on top, and that will be the Baton Rouge Clinic. For the overall award, what we thought we would start doing is we'll have a plaque that hangs at Blue Cross for vendors and people that come in and visit to see for the overall award. So it has names for all of you in the future. You have other slots, right?
Let me first of all congratulate the award winners here as part of the QBPC, because without those type of leaders within the community, it wouldn't be possible to have value-based healthcare. So congratulations to all you QBPC award winners.
We've had 450 physicians sign up to be part of this program in the first year, and that's far exceeded our expectations in year 1. The second thing, we hear from these practices who are involved with us that it's really working very well. They're very happy with the performance of the program. They're very gratified that Blue Cross is making this type of investment in primary care. And then finally, we've got some great clinical quality data to share today that suggests we actually are moving the needle in important ways here in Louisiana.
In a paper chart, world of before the electronic medical record, it was really impossible to be able to track patients over time and adequately manage things like hypertension and diabetes. The advent of the electronic medical record and the tools that Blue Cross has invested in that can actually connect to the electronic medical record provide physicians with good data and analytics to be able to manage populations, registries that can enable physicians to identify gaps in care, patients who perhaps don't have their blood pressure controlled who need to be contacted, or diabetics who haven't been seen in a while. It's just a phenomenal way of engaging and empowering primary care physicians to deliver higher quality care.
Better results for our patients are what every doctor wants to begin with, and we signed up for that when we went to medical school. My real feeling about the Quality Blue program allowed us to document that what we have been doing all along has been taking good care of our patients. I'm pleased to be recognized for the good work that we've done. I think it has added the incentive of giving us feedback on allowing us to meet those metrics on how well we actually are taking care of our patients, which was information that we did not have in times past.
Our increase in performance from when we started this program in August of 2013 to now has been dramatic. I think we've gone from mid-60s in hypertension control to 88%, and optimal diabetes care, probably have gone from mid-20s to 54% or somewhere around there. I think that's dramatic. I think that's a result of physician buy-in. I think it's a result of new patient engagement strategies that we've deployed, as well as taking advantage of the ability now to manage our patient population from an IT standpoint using the software that Blue Cross has provided. So I think all things working together has produced those outcomes.
In my opinion, diabetic management. The gains that we've made, this again, I just can't stress the information that we've been able to get through the Quality Blue program has actually illustrated on, in essence, some deficiencies that we had and being able to correct those.
Sometimes patients have a buy-in to it, sometimes they don't. So we actually try to work with the patient and their perspective and how they feel with regard to the health insurance company reaching out to them, or with our nursing staff reaching out to them in a different manner. Certainly our physicians have been very good at engaging the patient, educating them on the program. Like Dr. Hammock said, the IT portion that has been provided with Symphony has been extremely beneficial in this process because it lets us focus on the patients who have the most need. It lets us have a better means of communicating with them, where we send out letters to our patients reminding them of upcoming appointments and such. They sometimes don't pay attention. They get a phone call from the doctor's office saying, hey, you really are past due, it's time to come in. They're paying attention. So I think they understand it.
It's being aware of the gaps that are there, because a lot of times the patient tells you that something was done, but you're really not sure. And so when you have some actual data that says whether they did have something done or didn't have it done, then you're able to close that gap and make sure they get the proper care that they need.
The program with the Quality Blue program has allowed us better transparency amongst our providers. It has facilitated an opportunity to begin to achieve a greater awareness of not only does a doctor think they're practicing good medicine, but the data now that's driving behind it allows them to be proven to themselves that they're practicing good medicine, because the data is the data. And so much of what we try to achieve has to do with cross-disease, chronic disease management to lower the impact of cost of health care by providing good care on a preventative basis.
The reason why we're asking plans to really focus on value-based payment is what consumers are asking us to do. It's all about making certain that we deliver health outcomes that are high in quality and affordable for the American consumer.
The biggest benefit is that you're having an insurance company partner with you to help take care of their patients. Usually that's not the way it works, and so this is a big change as to how that happens. Instead of constantly worrying about what you're going to do next regarding patient care and what's going on, having an insurance company work with you and taking care of the patients is a huge advantage as to what's been going on in the past.
I think the most interesting statistic that we have seen in our practice, both at the clinic and within my own clinical practice as I practice internal medicine, is the review of multi-disease metrics, where not just getting one thing right, but 3, 4, or 5 things right has to be done in order to achieve optimum outcomes. It's very interesting to see how providers can have multiple metrics and have high scores, and yet when you have to get all 4 or all 3 or all 5 at one time, how low the score suddenly falls.
Physicians, I really think at the end of the day, really want to do the best they can for patients. I mean, they all want to provide high-level care. The problem is they're incredibly busy and distracted by all the changes in healthcare today, implementing electronic medical records, reporting quality metrics for a variety of different payers, including the federal government. Within that framework, it's really hard to get their attention to drive change. For me as a physician, realizing that we designed this program really to make it very easy on docs. And I think, at the end of the day, I think that was a very smart thing that we did, and I think it's why we've got so much adoption with this program.
If you look at throughout the world, in regions throughout the world, regions that have higher proportions of primary care physicians actually tend to have better health outcomes than regions that have fewer primary care physicians. Even here within the United States, if you look at regions that have higher proportions of primary care physicians, they tend to have better health outcomes, better management of especially chronic conditions. A great deal of that is due to better coordination of care, continuity of care. Study after study has shown the importance of continuity of care in maintaining high quality outcomes. And so really it's, no football team would ever really be successful without a quarterback. And just like no patient's really going to be successful in managing a large variety of their care without a quarterback to kind of help to coordinate that.
The patient buy-in, I think, is somewhat transparent to the patient for the most part. Unless they've been called by a nurse navigator, they're not as aware of it. We certainly hope to leverage our participation and our ability to deliver quality care in making that information available to our patients or those who would choose to use us in the future.
For the patient, it's really about having someone who can be accountable for making sure that all of their health needs are addressed in a coordinated manner so that it's not so disorganized and fragmented where nobody's talking to each other. You really need that person who can at least once a year, sort of address the whole person and know, are you up to date with all of your preventive health needs? How's your blood pressure? If you're diabetic, what has your blood sugar been doing? And sometimes when a patient seeks care across different specialties, that care can just become very fragmented and not coordinated so as to adequately address all of their health needs.
We're in this to make lives better. And this program provides you the tools, the data set, and the information in which you can impact thousands of lives in a very effective and a very efficient manner.
If we're really going to deliver on this vision of making certain that American healthcare is value-based, then it's important to make certain it's locally tailored. And so QBPC is exactly that. It's focused on what are the issues locally within Louisiana that leads to higher quality and more affordability specific for Louisiana.
I think one of the big challenges is how to continue the growth and to enroll more members, and that's one of the challenges that I've been thinking a lot about. We have typically gotten clinics that have a larger amount of Blue Cross members so that the impact is greater, but we need to somehow bring together those smaller practices that don't necessarily have a lot of Blue Cross members in the rural communities of the state, which we have a lot of members in those small communities. We need to bring them together in a way that it's feasible for them to get in this program.
What we really want is to have these primary care physicians spread throughout the state, such that regionally no person in Louisiana will be geographically that far from a quality blue primary care provider.
And we have about 450 docs today. We'd like that to be about 800 to 1,000, hopefully within the next 1 to 2 years. We'd like to have several 100,000 Blue Cross members within those programs. Not only will we continue to measure the impact on quality performance, but we'd like to also measure the impact on the cost of health care, which I think we'll be able to do in the second year. Beyond that, we'll do things like drive more of our members into primary care relationships, do a better job of marketing the value of having a primary care physician, and ultimately perhaps creating new products, new innovative products for Blue Cross that really use this quality blue primary care as the chassis, as the foundation for a better experience for our members.
Dashing through Natchitoches in a one-horse carriage, over the cane we go, laughing all the way, ha ha ha, lights aglow on Front Street, making spirits bright. What fun it is to come and see the bells we sing at night. 300 years of spirit still here, come and celebrate. It's our tricentennial and this year will be great. Christmas Fest, it's December 6th. Come and see the fireworks and our fancy kicks. Sarah Kay, Emily, Asia, Peyton and Kara too. We are this year's Christmas bells, here to be with you. Miss Merry Christmas is Madison. Come and see us all this year and we will make you grin. Natchitoches, Natchitoches, it's a magical town. 300,000 lights and bricks that cover the ground. Fireworks, fireworks, and a laser show. Enjoy eating our meat pies and help us wish for snow. Santa Claus, he's back for the 88th year. So come and grab a candy cane, 'cause Christmas is finally here. Merry Christmas, everyone!
Right now we are standing on the banks of Cane River Lake in downtown Natchitoches. This is the center point for all of our Natchitoches Christmas Festival activities. This will be where we have our entertainment, our vendors, our fireworks show will be right over Cane River Lake. So this is where everything takes place for the Natchitoches Christmas season. The Natchitoches Christmas is known as the 45 Nights of Lights because we actually kick off our Christmas Festival season on November 22nd, where we do our big lighting ceremony, and we have activities scheduled all the way in through January 6th. We'll have fireworks, entertainment, different events going on for 45 nights in downtown Natchitoches. The kickoff event is called Turn on the Holidays, and it will be Saturday, November 22nd. This is not only the kickoff to the Natchitoches Christmas Festival, but it is also kind of our wrap-up for our Natchitoches Tricentennial Festival. So we have great things planned all day long. It's a free event. It's open to everyone. It's family-friendly. We will have entertainment starting at 11 a.m. and continue all the way through 8:30 p.m. We'll have a great fireworks show at 7 p.m. where we turn on the lights officially for the first time in Natchitoches. We turn on 300,000 lights right here in downtown Natchitoches. We have set pieces, lighting on the bridge, lighting on downtown Front Street and all through the historic district. And we turn those lights on for the first time on November 22nd and kick it off with a big fireworks show. So it's just a great event, and we invite everyone to come out for that. The second big event would be our annual Christmas Festival. We are in our 88th year, and this year the Christmas Festival will take place on December 6th. This is the day where all of historic Natchitoches is full of vendors. We have people from all over come in. We have live entertainment. We have a great parade. And we have a spectacular fireworks show that illuminates both ends of the Cane River Lake. We'll have it on the north and the south end of the river. And it's just an incredible experience for everyone to come out and be a part of this great tradition in Natchitoches.
On December 6th, we will have our Christmas Festival. It will include a big fireworks show in 2 locations over here, and it will also have a big parade at 1 o'clock.
How has the Christmas Festival grown over the years?
Well, it's grown from in its infancy, just being very small, starting out very slow, to now at least 50,000 people are here, and during the whole season over 500,000 people visit and come and see the lights here on the riverbank.
My favorite part would have to be the fireworks display. The fireworks are just something that everyone can look forward to, and we not only have them for the Christmas Festival and our Turn on the Holidays event, but we also have them each weekend during the 45 Nights of Light. So if you miss the Christmas Festival or you miss Turn on the Holidays, you're still able to experience the spectacular fireworks show that we do here in Natchitoches. We do it right over Cane River Lake, and just a reflection of the fireworks on the lake is something that is so beautiful and so magical that everyone seems to enjoy, and that would be my favorite part.
If people have questions like more information, what should they do?
They can always visit our official Natchitoches Christmas website. It is natchitocheschristmas.com, and it will give you all the information for the 45 Nights of Lights, Turn on the Holidays, and the Natchitoches Christmas Festival.
We're the Christmas Bells, and we want to see you in Natchitoches this Christmas season. Merry Christmas!
This has been the Louisiana Hometown Network. If you have questions about this program, call us at Hometown Productions.